All right, so good morning, everybody, and welcome to today's webinar where we will be focusing on PSE efforts during COVID-19. My name is Dr. Jennifer King, and I am the Research Associate for the Building Capacity for Obesity Prevention Study at Case Western Reserve University. In this project, we've been working with the Ohio State University's SNAP-Ed Ohio program to bring you all this wonderful webinar that will allow you all to let us know what's going on in your day-to-day interactions in your communities, in your counties, and we would like to see how we might be able to help you figure out what's the best next step or starting steps for really battling through PSE efforts and sharing successes for PSE efforts during COVID-19. So as a little bit of background, I just wanted to let you all know that with this study, it is again a partnership between Case Western Reserve University, specifically the Mary Ann Sweatland Center for Environmental Health, and again, the Ohio State University SNAP-Ed Ohio program. The names that you see on the screen are not necessarily everyone that you will hear from today, but I just wanted to let you all know who you might be able to interact with during the next couple of months from both Case Western Reserve University and Ohio State University. So today you will be hearing from myself, Dr. Ana Claudia Zubieta, who is the Ohio SNAP-Ed Director. So no surprise there, you all know who she is. But we'll also be hearing from our PSE Specialists, Megan, Tina, and Patrick. We also have Dr. Owuswa Yamoa, who is a postdoctoral scholar on the BCOP project, as one of our chat room or chat box and Q&A moderators. Now, a little bit of housekeeping to get ourselves organized. You all are going to be muted as attendees, but as the panelists kind of go through our presentations, we'll be able to unmute ourselves. But we want you to be able to still communicate with us. So you can use the chat box, as some of you have already done, by saying good morning, but please be sure to utilize the feature that says to, and you want to make sure that you are sending your messages to all panelists and attendees. You can also use the Q&A feature to ask questions for today's presenters. We will reserve some time for a Q&A session to respond to those questions, but we just want to make sure that you feel comfortable being able to send them in as we go. Today's webinar is being recorded, so there will be the recording available, if not tomorrow, early next week. So we're happy to still have that for you all. And if at any time you are having some technical difficulties with connection with Zoom, please contact your PSE specialist and they will help you to get back into the webinar today. Now, as part of our community agreement, just being online, being on Zoom, let's just agree to all be patient with each other and, of course, all be respectful of each other. All right. So I'm going to try to activate a poll for you all just to see where everyone is coming from. And with this map, it shouldn't be anything new to you because it shows the region that can represent your service area. But I know maybe a few of you, handful, might work in multiple areas. So I'm going to try to activate the poll. All right. And I will give you all about a minute to let us know where you all are from.
Jennifer,
Yes.
apparently they can't vote.
So as a panelist, you are not able to vote.
Yeah,
Because
so I
you
know that some of us, or the PSE Specialist sent a reminder email out the other day, and we just wanted to make sure that everyone had a link and was able to get on. So if someone was using that link that either Megan, Tina, or I sent, you're technically under ours because I didn't know how webinars work, so you may not be able to participate in the poll. So if it's not working, why don't you just go ahead and put your answer in the chat box, and we'll be able to see where you are and just add into your comments then. Sorry about that, everyone.
Okay, thank you for clarifying. So we're going to go ahead and close the polling for right now. And it looks like Tina is the most represented. Tina's area is in blue with about 49% of you who were able to complete the poll are from kind of the northeast Ohio area. Patrick came in second with 32% down in our southern region, and Megan came in at 21% with our western Ohio and kind of western, southwestern region as well. So I should be able to share, I can share the results with you. So sorry about that. I didn't mean to repeat everything to you, but thank you for everyone who is putting what their region or regions are in the chat box.
Jennifer, just to note, most individuals in the chat box are reporting red and green. So definitely that those percentages will be different if we could see them.
Yeah, I do understand that, and I can save the chat box messages to have it reflect into what the polls are saying.
Yeah, thank you.
So that's the only poll that we will have for today. So no worries about that going forward. All right. So with the building capacity for obesity prevention project, it is a mouthful, and so many things that we kind of say with the project and what's associated with the study is kind of a mouthful. So you may hear some acronyms that are being thrown out there, but I don't want you to be alarmed by what they mean or what they are. Really today, we're going to focus on BCOP, using PSEs, understanding what those efforts are, and you might hear the PSE Ready, which is the assessment and decision instrument that the project is really focused on. It's not anything that we're going to focus on necessarily today, but it is something that you all will hear about in the near future. So just wanting to make sure that you all felt comfortable with the couple of acronyms that we're going to be using today. And what you see on the right-hand side of the screen, you may not necessarily hear those today, but those do exist with the project as well. All right. So after today, we are all hoping that as an attendee, you understand what are the expectations of being able to implement PSE efforts in this era of COVID-19 to ultimately support your community nutrition work. We also hope that you feel comfortable in being able to identify challenges as well as opportunities to be able to actually implement community nutrition PSE efforts in the era of COVID-19. Lastly, we hope that you feel that you are able to further discuss the impacts of the pandemic and its association with PSE efforts that relate to the PSE Ready topic areas. So I'm going to take a little bit of a break, and you're going to hear from Anna Claudia about what are kind of the expectations and direction for Ohio SNAP Ed with PSE efforts.
Thank you, Jennifer. Hello, good morning, everyone. I know I have seen many of you during the last couple of weeks at the regional meetings, so I do appreciate your dedication and flexibility as we continue to work during challenging times and be on the screen so much instead of in person. So thank you again for joining us today. And I'm gonna just talk a little bit about our direction with SNAP-Ed Ohio and PSEs and why this is important. So we are all aware of the challenges the pandemic has caused us personally and professionally, not to mention to SNAP-Ed programming. We also know that COVID has created many difficulties for the SNAP-Ed target audience, which has led to new opportunities for us to intervene as a program. The SNAP-Ed guidance still requires SNAP-Ed to continue to work on PSE activities, and we are held accountable to that requirement. Therefore, Ohio SNAP-Ed will continue to advance our PSE work, and PAs and PCs continue to be expected to report on at least one PSE effort at any stage of its development on an annual basis. So there are still opportunities to identify new PSE efforts as well as to adapt plans to continue to make progress on current efforts. During these times, we continue to develop tools and provide support to accomplish your goals. The SNAP-Ed PSE Specialists have been part of our team for about 6 months, and during this time, they have worked hard to get to know you, learn about PSE opportunities at the local level and also statewide, and have started and strongly collaborated with BCOP, the BCOP team, to make sure that there is this correlation and what the needs are. The BCOP understands our needs, and we understand what BCOP can offer our program as well. As most of you know, the PSE Ready tool is an important tool for assessing, planning, and implementing PSE activities. And here I go with the acronym, right? It's good that Jennifer went over PSE Ready for those of you especially that are new to the program. So today's training is set up to understand the challenges and opportunities that the COVID environment presents, and how the tools and resources that are available can help you manage and succeed in this environment. So PSE efforts should be reported during all stages of implementation and consider interventions at all stages. We will talk about reporting PSEs more as we move into that module of pairs in a couple of weeks, maybe a month and a half. But every time you report a PSE effort, it's considered an intervention. Examples are gather information such as population data and target audience input. Assess community needs to identify gaps and opportunities for new PSE efforts. Identify new partners for PSE efforts and continue to plan PSE efforts with current partners while building and maintaining relationships. Participate in the development of plans for PSE efforts. Participate in the implementation of PSEs, and participate in evaluating those PSEs. Last but not least, update new progress on PSE efforts from previous fiscal years is also considered an intervention. So it's important to remember that reporting PSEs at any step of the way, it's important and valuable. You do not have to have a full-blown PSE for it to count. The SNAP-Ed state and regional teams are here to support you and guide you. So please take advantage of that and use the resources available to you. While working together, we will find new paths and opportunities to move ahead. So thank you, and now I'm gonna pass it back to Jennifer.
All right, thank you, Anaconda. Okay. All right, so during the registration process, we asked you to tell us about the different PSE efforts that you may have been engaged in prior to COVID-19, and what challenges may have arisen with these efforts since its onset. Okay. So before we get into what you all were engaged in, we want to make sure that everyone feels comfortable with the definition of a PSE. which is a policy, systems, or environmental effort or intervention that is placed into the community to ultimately promote healthy eating for chronic disease prevention. PSEs help make environments match healthy eating messages that are promoted by making the healthy choice the easy choice. And this is going to be wherever your clients or residents are, as where they live, where they work, where they learn, and where they play. Now with PSEs, we do have kind of these three different categories, and each kind of seek out to do different things, whether that is targeting government entities at the national, state, or local levels. Policies can also target organizations such as schools, child care centers, businesses, or religious institutions. With systems, you're really seeking to have a change and influence on how communities are able to provide services for their residents. Lastly, with environmental change, there is the hope to include a developing or enhancing of local infrastructure or promoting of social norms to lift or shift behaviors within environments. So again, that's going to be wherever your residents are, where they live, where they work, where they learn, and where they play. So again, we asked you kind of what kind of efforts, policies, systems, or environmental were you all involved in? And we broke it down into the categories in which the BCOP project focuses on. So for right now, we are, our current focus areas include healthy eating and childcare, farmers markets, healthy food retail, and farm to school. We added in two other areas because those are two areas that we are wanting to learn a bit more information about. And it was actually really interesting to see that a lot of you, 30%, as you can see on the screen, have been involved in healthy eating and healthy eating efforts in K through 12 schools. Farmers markets and healthy eating and food pantries are about neck and neck, but there is overall a lot of variety in what you all were doing prior to COVID-19. Now, I want to take a closer look at your PSE efforts. All right. So to get into a couple of specifics, you all were engaged in direct education that was integrated with your PSE efforts, whether that was having farm to school programs or smarter lunchrooms, including vending options, a sharing table, or even salad bars for students. There was a lot with programming, which I really liked. There were so many of you introducing produce perks into the farmers markets that your county or community may have going on, or looking into produce perks in the retail side to see how that program might be able to work best for you. And a lot of you were involved in partnerships. So coalitions, committees, and varying agencies to coordinate farmers market transportation, after school programming, and choice pantries. So you all had a lot going on and a lot of great work going on that is remarkable. But we know that with the onset of COVID-19, things had to slow down or completely stop. So we also asked you what were the challenges that you may have experienced with being able to engage in PSE efforts since the onset of COVID-19. So since about mid to late March or even early April. Many of you, rightfully so, noted that you had issues connecting with partners and getting them on board. As their priorities for efforts have changed, there has been less time and less room for having discussions about some projects or programs that you may have wanted to get started or there's just no time and really no opportunities for face-to-face discussion. With having limited access to partners, there's also the limited access to your participants. By having everyone globally rely on internet access, there are connectivity issues. There are also issues with being able to access facilities because so many places have remained closed since March or April. There's also just overall decreased participation and opportunity for engagement. Again, as priorities for some individuals and how their lifestyles have changed, they may not necessarily be able to prioritize the programs that you all were instituting prior to COVID-19. Time management. There just isn't enough time in the day. There aren't enough hours in the day to really be able to do everything. And for many of you, you may just not know how to get started. You may not know for sure where you want to be able to start with the PSE efforts, given what's going on, or to be able to refocus those efforts due to changes in priorities. Now, with those questions, we wanted to provide another one to allow you all to answer live by using the chat feature. So, what challenges may you all have experienced with PSE efforts even before the onset of COVID-19? And again, what I would like for you to do is to use the chat box to respond to all panelists and all attendees. We're just trying to see, even without the idea of a pandemic, what may have been some challenges for some of you who were trying to implement PSE efforts. And we're going to take about 30 seconds or so to pop those questions into the chat box. Okay, so I'm seeing that there are a lot of messages about sustainability, and that might be, and I think there are some other responses that can kind of fall under that. That can be getting partners on board, and maybe those who are definitely resistant to change, getting volunteers on board, getting administrators on board. For some of you, it's getting started, and that is certainly still very valid and very true. Just not necessarily knowing where to focus your efforts again. Being patient, oh wow, that is really good, especially when partners aren't ready to get on board, when you might see a really good opportunity. Getting funding, getting commitment. All right. So there certainly is a lot of variety in what you all are saying are challenges, but so many of you, even if you don't interact with each other every day, as you might be in different regions, and you might be on different sides of the state, I want you all to understand that many of you are all going through or have gone through the same challenges. And that's really what we want to focus on today, is that you all have the same challenges, whether it was before or during COVID-19. And we really want to help you all understand what are potential successes that you might be able to have with your PSE efforts. So thank you all for your transparency and sharing what challenges you have experienced. All right. So I know that you're probably tired of hearing this saying of the new normal. Well, honestly, I feel like each day, because no one has enough time in the day to get everything done. So every day is a new normal of shifting what needs to be prioritized and needs to be done. But with this new normal that changes each day, that is definitely, it comes with challenges as well as opportunities to reimagine our work. And for us specifically, it's going to be reimagining the approaches for PSE efforts. So again, during the registration process, we ask that you tell us about what successes you may have experienced with your efforts of implementing PSEs since the onset of COVID-19. And again, we have amazing answers. Many of you have been able to say that you have been able to foster partnerships. So that has been kind of taking possibly another look at who you're already collaborating with and seeing how you can continue to get information out to people, whether those are newsletters or recipe cards to be dropped in boxes at food pantries, providing incentives at food pantries, and even someone amongst us has been able to have a guest blog feature to be able to promote PSE efforts. I believe it's in Lima that there was a Food Policy Council resolution passed, but there are also so many other things that are great that are going on. Having the community distribution of veggie planters to support gardening. Again, fostering partnerships and collaborating with partners, especially as some of you have been able to cultivate a list of local agencies that you might be able to tap into. There has also been just time to kind of sit back and redesign health objectives. For example, a school wellness policy. And I'm not sure what county this was in, but if you can pop it into the chat, that would be helpful to see where the Urban Farm Award was provided. So there's a lot going on, or that has been going on, that we would consider successes. So again, I want you all to use the chat box to let us know what additional successes we may have missed. I can get my animation. All right, cool. So my animation pops up for me. Again, I want you to use the chat box and reply to everyone, all panelists and all attendees. And I'll take about 30 seconds again to just see what you all have been able to do. All right, congratulations, Knox County, for the Farm to School Planning Grant. That is awesome. So someone had, many of you had considered funding to be an issue. So that is awesome. I'm seeing pop-up farmers markets with the use of senior coupons, SNAP, produce perks, attending meetings, being able to distribute seeds for gardening. Okay, so kind of shifting your focus of being able to work with parents to then work with educators. That's awesome. All right. So now you're going to have an opportunity to hear from your own PSE specialist. And each of them will share a few opportunities for PSE efforts that you might be able to engage in your community and your county. For Megan, Tina, and Patrick, you all just let me know when you need me to advance to the next slide, and I'm good to go.
Okay, you can advance to the next slide. All right, so healthy eating and food pantries is, there are a couple programs out there. The basis of both of those programs is that any farmer who grows food does not want to throw it away. So the Families to Food Box program is like part of the Coronavirus Food Assistance Program. So through the Farm to Families Food Box program, the USDA partners with national, regional, and local producers and growers whose workforces have been impacted by COVID. So like they are not able to distribute to restaurants or other food service businesses. So the program reimburses the producers and growers for packaging fresh fruits and veggies, fresh dairy, and fresh meat into family-sized boxes. And then they also transport them to like food banks, food pantries that request distributions, and other nonprofits and faith-based organizations that serve people in need. Currently, the second round is taking place now through the end of August, but President Trump just announced recently that he added an additional $1 billion to extend the program through October. So what we can do is help connect our local pantries to the program. The website will give you more information on like facts, that frequently asked questions, that kind of thing. But basically, our food pantries would have to show proof of their 501c status to the distributor, as well as have the ability to store and distribute the boxes in a timely manner. Along with that, you can add educational materials to those boxes as well, like how to prepare and store whatever's in season, because that's most likely the produce that they will be getting. And then the farm to food pantry is very similar, but it's mostly state funded, and it has the similar goals of reimbursing farmers for picking, packaging, and transporting cosmetically challenged, too small or too big or too much produce that would otherwise be plowed under. So it's specific to produce. The link here is for a toolkit that kind of tells you how to get that program up and running with your food pantry and connect. But in Ohio, the Ohio Ag Clearance Program, and I'll type that in the chat box after I finish speaking, like connects with over 100 local farmers, producers, and growers in Ohio, and it distributes to food banks throughout the state. And that website actually has a list of those food banks. So you can connect with those that are in your area, help connect local pantries to those larger food banks to get those distributions of fresh produce. And then you can also provide educational materials about the produce that's in season. And the third thing that's not listed here that we learned about recently, which leads me into produce perks, but specifically for food pantries, is there's a new program through Produce Perks. It's a TAMF coupons, so people can apply for TAMF at the distribution site, and we can connect like a food pantry, and those coupons can be distributed at the through the food pantry. And other agencies as well. I know Delaware County connected Produce Perks with their Head Starts to have those coupons distributed. And again, you can provide educational materials on what's in season. The coupons are, I think, $40, and they're, can be used at farmers markets and stuff for the purchase of fresh produce. And then everybody should be familiar with Produce Perks and connecting their farmers markets to Produce Perks. And that's the Double Up program, the incentive program. Also, I provided here the market link, which provides you that that resource for helping your farmers market get equipment to accept EBT. And I will turn it over to, I believe Megan is next.
Yeah, you could advance to the next slide. Thank you. Okay, so a couple more things that we can do during this time is we have a healthy food retail initiative, which is also the Healthy Corner Stores initiative. And this food trust document, which again, we will provide all of these links through email after the presentation. But this toolkit basically walks you through being able to have different levels of change. You could do them in a corner store setting, but you could also do them in other stores where food is sold. But there's different levels of change that you could work with a store owner to do things like changing inventory or marketing materials. Something really simple you could do is, having like my plate messages or different healthy recommendations near the foods that are appropriate. So for instance, if like near the produce section, you could have a sign that says make half your plates fruits and vegetables. Near where the milk is sold, you could have a reminder there that reminds people that are shopping to make milk purchases that are 1% or skim milk. Make half your grains whole, those kinds of messages. So you could put those through the store. You could help them with the addition of equipment. So adding things like refrigerators to be able to store foods that are healthy. There's also some to the store owners to make their healthy food inventory more profitable. And so you can, work with store owners to kind of phase in activities. So you could start with simple ones like, rearranging where food is throughout the store, or having those marketing materials, and then slowly phase into more, detailed changes. So also with healthy eating in childcare, this example has to do with early childhood education. And so Farm to ECE, which has 3 core elements, which is education, gardens, and procurement. And I had been working with a group of 5 counties in the Northwest region who are working collaboratively on a Farm to ECE effort, and have been. And their efforts mostly have included direct education, along with the addition of school gardens on site at Head Start centers. And during this time of work, they are still working to provide those lessons virtually to the students, but with not being able to do taste testings or things like that of different kinds of produce. And so we're talking about the challenges with COVID-19 and not being able to be in the classrooms physically, not being able to utilize the gardens and those kinds of things. And so we talked about the natural step in their work being to start, identifying local procurement. And so we, working with those 5 counties, all share a Head Start health and food safety coordinator or director, and she is in charge of ordering food and making menus and things like that at all the 5 locations in each county.
Okay, so I'm not sure if we lost.
I got kicked out. Can you hear me now?
Yeah, we can.
Yeah, we can hear you.
Sorry about that. So I'm not sure where you guys all heard me leave off, but anyways, so they were able to start to work with their coordinator at the Head Start location, or at the Head Start, to identify some local procurement, some local producers and local distribution systems to get local foods at the Head Start locations. And so they started with milk because they felt that was the easiest thing to do, since they knew a local producer that they had used before milk to a couple of the locations. So they basically just expanded those efforts to, or trying to expand those efforts to all of those locations.
All right, so I think that Megan got kicked out again.
Yeah.
Okay,
So too.
for the sake of time, we're just going to go ahead and proceed with Patrick's overview of Farm to School and healthy eating in K through 12 schools.
So they were.
Yeah, sometimes it's delayed, Jennifer, and so maybe she. Megan, we're gonna move on with Patrick based on time and because you keep getting disconnected.
So I know I saw a question in the chat box about will these links provide the examples that we were talking about? And yeah, they will. They're toolkits. So a lot of it is how um, examples of how to go about doing this, especially for the farm to school or farm to ECE. Both of those cover all those three areas that we talked about. And if one is particular, if you want to learn more information about it, feel free to reach out to your PSE specialist and we can help find more information for you on one of those specific examples if you want. So moving on, this is also a time when you could potentially be working on, farm to school. So meals are going to look a lot different in classrooms just based off of everything that's going on. But there's still a need for that, whether it be, in the regular lunchroom with social distancing rules in place, in the classroom. There's even some schools that are using now grab and go lunches or still sending food home with students who are involved with that. So trying to connect the procurement individuals at the school or the lunchroom manager to try and find those specific way to connect, farmers and what their produce and fruit in with the school lunches that are being sent home, especially with the amount of food that's not being used or potentially being plowed under. It's still a good way to do it. I know some people have also worked with schools to do sort of the gardening side of things too, to try and collaborate and figure out a way to incorporate planting and gardening at home, whether it be looking at seeds and how they grow or other things like that to incorporate the gardening aspect of it with farm to school. Then for healthy eating in K-12, it's similar to what we were saying. It's going to look a lot different, but there's still other ways that you could try and incorporate healthy eating and healthy options within the new ways that they are, serving the meals and adapting to the reality that is now around COVID, since everyone still needs to eat. I did want to mention that I had learned that the Smarter Lunchrooms movement isn't the most research-based thing, and there was some falsified data on it. So with that, if you are going to, use that link, just know that you can use the ideas, but some of the data that they have with it isn't the most accurate. So if you do want to go look at that, feel free to reach out to one of us or your PSE specialist, and we'll be able to help with clarifying some of that issues with that. But it's still a good site to look for ideas on how to potentially offer some PSE efforts within the lunchrooms or so I guess the data on what, so the Smarter Lunchroom movement is a research-based program, but some of the data supporting it was not accurately kept. So it's still something that we can use to get ideas from. But as far as using the whole thing as a whole, it would be bad to go up to your classroom and be like, hey, here's a research-based data that's 100% accurate, going to change it. But we can still get ideas from it to use with our programs. It's just bad to go and say like, here's a full-fledged thing that's going to absolutely work. But some of the ideas are still really good and fit into what we do. So that's why it's good to still read up on it. And then that is all that I have for farm to school and K-12. So I'll turn it back over to Jennifer.
Awesome. Thank you again, Patrick, Megan, and Tina for your really good overview with what seem to be really good resources that the attendees will be able to access at a later time. So to get us moving along, I of course want to be mindful of everyone's time this morning. I wanted to take a pause to see if any of our attendees had any questions. You can send your questions, as you all have been doing, in the chat box, or if there's something else that you might want to send, you can use the Q&A feature. both are listed or available as you hover over your navigation bar on Zoom. But it's not any pressure that you have to ask a question if you don't have one right now. And of course, like any other meeting or call that you have, you will come up with a question the second that we end. So if you do, feel free to reach out to your PSE specialist to ask that question. Feel free to reach out to the BCOP team to ask that question as well. And I will provide the email address for BCOP at the conclusion of the webinar.
So there's a question in the chat that I'm seeing, and it was based off one of the examples that Tina gave, and the TAMF is an acronym for Temporary Assistance for Needy Families. So it's something that families can apply for through JFS if needed. But it's commonly, mentioned as TAMF or TANF.
Awesome. Thank you, Patrick.
They can also if they connect with Produce Perks, they actually, when they distribute the coupons, they have they can actually sign up right on site. So
I know that we have very limited time today. This was kind of like the triggering conversation and dialogue. And so I want to invite everyone to make sure that you connect individually with your PSE specialists to kind of go deeper into some of these ideas and understand the possibilities for your communities. So just don't think that once we finish this webinar, we're done. You are 100% invited to connect one-on-one with your PSE specialist and think through some of this stuff deeper.
All right. So just again, because I want to be mindful of our time and we do have a little bit more to review, please continue to send in your questions using the chat box. Tina, I think there was a question about a link to get more information about the TANF coupons. So if you can provide that in the chat box, that would be awesome. And again, this conversation, just so we can see my question mark, this conversation does not stop today, and it doesn't just stop with those who are on this call, or definitely myself. Like, feel free to reach out to your PSE specialist, Claudia, the BCOP team at CASE, if you need help or clarity on anything. All right. So next step, you're probably wondering, like, okay, so what are we going to do during our next, like, really filled call of discussion and interaction with each other and better use of polls? I want you all to mark your calendars, and these are dates that are going to be reiterated and provided to you again by your PSE specialist. So based on the feedback that you all provided during the registration process, in the chat box, and what is soon to come with the post-webinar survey about the challenges you've experienced with your PSE efforts, as well as your successes, our next webinar will introduce how you may be able to use the PSE Ready, which again is the PSE Readiness Assessment and Decision Instrument, to address these issues and help boost both your confidence and your overall readiness to either begin or re-engage or refocus the work that you have been doing. Additionally, I mentioned earlier that we have these two new areas that we want to focus on: healthy eating in food pantries, as well as healthy eating in K-12 schools. So what we would like to do is to get some additional feedback about any PSE effort or experience that you have had to help us be able to develop these new areas. So with the feedback, it's actually going to be targeted to 9 out of the 88 counties throughout Ohio, and it's going to be sprinkled throughout the 3 regions. So if you see your county listed on the screen, between mid-September through December, we will be reaching out to you to get some more information about your experience with doing PSEs, what you would like to do with PSEs, again, focused on food pantries as well as K through 12 schools. Now, for those of you who have not been in the selected county, this doesn't mean that your input is not important. We still, of course, want to hear back from you about your PSE efforts. So feel free again to use our email addresses to let us know what all you have going on. But it will be helpful to just make sure that if you are emailing the BCOP team, just let us know what county you're from so that we can keep a detailed list of everything. All right. So Anna Claudia, as we lead into your final thoughts, I wanted to make sure to see if you had anything that you wanted to add while I'm on the data collection slide.
Well, maybe just reiterate that these two new additions to the PSE Ready tool are really a response to what SNAP-Ed is doing and the concentration of our PSE efforts. As you can see, almost half of the PSE efforts that were reported had to do with schools and food pantries. And that was the feedback that we received about now maybe a year and a half ago from PAs and PCs that when we presented the PSE Ready tool, they were like, well, we need also some these categories because we are doing a lot of work there. So this is responding to those needs and to some of your suggestions as well. So we appreciate BCOP work on this, and Case Western has done an amazing job and continue to do an amazing job helping us create tools that will help us in the long run, or maybe medium run. So yeah, I'm done with this slide. Thank you, Jennifer. Yeah, so final thoughts. I just want to make sure that everybody knows that SNAP-Ed is not the creator of a PSE. We are here to support efforts in our communities, and we are not able to do it ourselves if they're not partners involved to make it sustainable, as many of you suggested were some of the challenges. PSEs can exist. So fostering those relationships and continue to create other relationships and that network, it's already part of a PSE. So I want to make sure that you understand that a full-blown PSE from planning to evaluating is not what you need to be reporting every year. The small steps and the very targeted steps to a full-blown PSE, it's what we are looking for every year as reporting. So I appreciate everyone's time and everyone's input and participation in this webinar. I know, again, we have had several in the last couple of weeks, so this is really good, and I hope it facilitated and it helped some of the questions that everybody that has around PSEs during COVID. So thank you, everyone. And Jennifer, back to you.
Awesome. Again, I just want to reiterate what Anna Claudia has said and what we're also seeing from our PSE specialists and our attendees. Just thank you all for attending. I want to thank the amazing team that has been behind the scenes with developing this webinar, getting our slides together, and moderating our chat box. So thank you so much to Anna Claudia, Pat, Megan, Tina, and Owuswa. You all have been really great to work with, and I look forward to continuing to work with everyone who is on the call, whether you are a panelist or an attendee. If you have any questions, again, I'm going to tell you, please contact the BCOP project at CASE. We're here to answer your emails. It goes to my inbox, so either myself or our principal investigator, Darcy Friedman, will respond to your email, or if it's something that we may not be able to answer, we can definitely get that question or concern to SNAP Ed Ohio staff. The last thing I want to say is please do not close your browser. I have hopefully set it up correctly that a post-webinar survey should pop up immediately after the webinar has ended. And it's going to ask you a series of questions just about kind of what are your next steps? What have you been able to kind of gain as far as being able to really adhere to those objectives that we listed out earlier in the webinar? If for any reason the survey does not pop up for you, please email me at bcop@case.edu and I will respond to you and provide the link directly. All right.
Thank you so much, Jennifer, and your team. You guys have been wonderful to work with. We look forward to continue our partnership in fiscal year 21.
Awesome. Thank you all, and I look forward to virtually seeing everyone again soon, September 30th for the next webinar, and September through December for our nine counties. There is a quick question that I want to respond to about the recording. I will send the recording to the PSE Specialist, and then they can get it out to everyone. And then I can also have the recording posted on the pseready.org website. So I do have everyone's email who registered today. So there are a number of ways of getting in touch with you all. So there's no worries, you will have access to the recording. Thank you, everyone. I'm going to go ahead and end our webinar.
One quick announcement. There was one question about a date for the parish training, and that's going to be on 10/13. So we'll make sure the PSE Specialist will send out an email with that date provided and a link in the near future. So we'll make sure to get that to you in an email and a Zoom invite as well. So sorry, I just